our expert in this session today. Nathan is a member of the Congress Program Committee and has got a lot of experience in submitting focus symposia. He has chaired several focus symposia at World Physiotherapy Congresses in the past, and the best person to throw all your questions out at Nathan. We also have Lucy from the World Physiotherapy team here, if there's any questions on the submission system or more technical questions. Okay, so the idea is really to say, you come up with your questions. Ideally, really put up your hand and then you can switch on your camera or not. It's really up to you, and ask your question. So think about what you would like to know from Nathan. And we are aware that sometimes at the beginning it can be a bit quiet on these platforms. So I would like to start with a question for Nathan and then keep an eye on any hands that are up. So Nathan, what would you say, what are the key features of a focused symposium?
Yes, so first of all, welcome everyone, and thank you, Birgit and World Physiotherapy for having me here in this session, because I think the focus symposia are really very important sessions. We don't have those keynote sessions anymore at the World Physiotherapy Congress. So the focus symposia are really the big sessions at the conference. So it's really nice that you are all thinking about submitting a focus symposium. So I think there are a few characteristics or key features of focus symposia. And one of the things is that these are containing some linked presentations. So it is a very important topic, and we will definitely discuss what kind of topics would fit for a focus symposium later. But it's really a linked presentations. And of course, there is also a chair in the focus symposium, which is a recognized expert in the field. And then, of course, these should be very contemporary topics. Sometimes it can also be some discussion topics, but really cutting edge topics are very important, I think, to have those focus as topics of those focus symposia. And then you merely make a session, a coherent session of speakers in such a session. So these are linked presentations, chair by chair, and then we have a maximum of 3 presentations in addition to the chair. And then there is also always room for discussion with the audience. So after an introduction by the chair, you have those linked presentations, and then you have also some time for discussion with the audience. And I think these are one of the key points of the focus symposia. It's also important to understand and to emphasize that previously, before the last conference in Dubai, these focus symposia lasted for 90 minutes. And since Dubai and also in Tokyo, they will last for 60 minutes. So that's also important to keep in your mind when you are drafting the outline for a focus symposia.
Great, thank you, Nathan. So I'm just looking at the participants. As I said, please come up with your individual questions. This is your opportunity to ask anything related to focus symposia and any specific question to your topic you may have. So Nathan, you mentioned that it is very important to have these linked presentations. So let's say someone has never led on a focus symposia submission in the past. How should they go about in finding colleagues who might be suitable to submit a proposal with?
Yeah, so I think the first thing to start with is you need to have a great idea. At least you need to be convinced that your idea, the topic, is very important for world physiotherapy, for global physiotherapy, because that's where it all starts with. So a good topic is the basis, of course. And then, of course, I also said that it's in the guidelines, and I have them. I'm blurred, but I have the guidelines right here, so you can also find them on the website. You can also see all the steps that you can take and the important stuff there. But as I said before, the chair is a recognized expert in the field. So the first step is you might be in doubt if you are that expert. And if you think I have a good idea, but I'm not the expert, the recognized expert in the field, then the first step is also to reach out to colleagues. So if you, we also like to have some early career researchers, for example, as in the focus symposia. So maybe you can reach out to your professor who might be the international recognized expert on this field and involve such an expert in your focus symposia. So keep that in your mind. You don't need to be the chair yourself if you don't feel comfortable, or you can also invite another chair to join your group of presenters. And then I think it's important to get a nice group of speakers, of people around you. So basically you have a kind of network. Maybe you work together on you wrote some papers with other experts. So maybe you can invite them to cooperate with you. Sometimes you have maybe two or one other speaker who is willing to cooperate with you, but you need to have some additional speakers. And that sometimes can be challenging because, and we will discuss that definitely later, we also want to have some diversity with regard to countries of origin and those kind of things. But what I also did in the past was just look and use Google or PubMed and then put in the topic that you are wanting to present on, the topic of your focus symposia, and then see who has also published on this topic and who can really have added value for your submission. Because I think strong submissions also include different perspectives. So these linked presentations have different perspectives, and then you can find other potential speakers as well. And also one other thing, I also saw that on X, the former Twitter, last week, that people sometimes also reach out on social media. So they have a kind of idea, they want to submit a focus symposium, and then they also reach out for people who would like to join them in that submission. So that's also one of the things that you could do. But I think if you are working in a kind of area and you have a kind of expertise, then you will know some of the people you can cooperate with, I guess.
Great, thank you, Nathan. That's really a very comprehensive answer, really helpful. In the chat, there was a question by someone whether focus symposium can be submitted also by multidisciplinary teams or only by physiotherapists. Do you want to comment on that one, Nathan?
Yeah, so first of all, it is a World Physiotherapy Congress. So the focus is on physiotherapy, of course. But of course, with regard to diversity in different perspective and different topics, I think it would work very well also to include other disciplines in your submission. It's not needed, it's not necessary, but if you think that the topic that you want to present on, your topic of the focus symposium, really requires or benefits from also perspective from other disciplinaries, or you can also imagine from other stakeholders or patient perspective, then you are free to include those perspectives as well. But of course, you should keep in your mind that it is a physiotherapy congress, so it should be relevant for the physiotherapy profession. And it's also required that presenters also attend the conference and also register for the conference. So you should also talk with your colleagues then if they have another profession, if they are also interested in joining the World Physiotherapy Congress as an attendant as well, as an attendee as well.
Great, thank you, Nathan. I think that's a very important point, that all the chairs and presenters of focus symposia need to attend and need to register and also need to pay for the registration. So there's no speaker fee that we pay for focus symposia presenters. I think that's a very important point. There was a question by Stacy. Can the chair also be one of the presenters?
Yes, so that is definitely possible. So there is a maximum number of people involved. So that's also included in the guidelines. So be aware that if that number, so it is the chair and a maximum of 3 additional speakers. So the maximum number of total speakers or people involved is 4. And definitely the chair can be one of the presenters. And from my personal perspective, I think it's very valuable to have the chair also presenting. Because if we say the chair is a recognized expert in the field, I found it sometimes also a little bit disappointing that the chair in the focus symposium was not really presenting. because we also want to hear of that expert, their opinion or their experience in that area. So I think it's very strong to include the chair as a presenter, but it's not mandatory. You are allowed to, for the chair, only to chair the symposium and to have other presenters. So both is possible, but it is definitely allowed.
Great, thank you. So
And maybe one other thing is,
yeah.
in the submission system, if the chair is also presenting, you also need to indicate that in the submission system, because you have to add the title of each individual presentation in the submission system. So you should also then make clear that the chair is also a presenter as well.
Yes, so in the submission, the chair would, if he's involved, he or she is involved as a presenter, then they would appear in the submission twice under the chair role and as a speaker role. So thanks for explaining this potentially dual role of presenting from the expert view, but then also being the one who brings the presentation together and points out how they complement each other and how they are linked together. There's a question from David. If you are submitting a focus symposium and someone else has asked you to participate in another submission, is this allowed?
No, that is not allowed. So you can only be in one submission, either as a chair or a speaker. You can only appear in one submission. So that's very important to know. And also, when you are the chair and you invite other people to present, also maybe let them know that they cannot appear in another submission, because sometimes they get requests from other people as well, and they don't know the definite of the exact submission guidelines. So make sure that also your presenters and your symposium know that they can only appear in one submission. So you cannot be a chair in this submission and in another submission you can be a presenter, or a presenter in two submissions. That is not allowed.
Mm-hmm. Thank you, Nathan. And perhaps also to expand on that, the previous CPC was in a situation where there were people appearing in two submissions, and then we had to contact the chair and say, unfortunately, this person cannot be part of your presentation because they are already involved in a different presentation. So this puts the chair really in a difficult position when they suddenly then need to find someone else to step in for that person. So please be aware of that chairs and speakers can only appear in one proposal. There's Sophie from Ethiopia, and my question is, after we submit the proposal with one chair and other 4 people, do we manage to come to the symposium? Like the transportation is on, house accommodation, how much is given to one group? So perhaps this is something that I can comment on. So first of all, it can be a maximum, the team can be a maximum of 4, as Nathan has said before. So the chair plus 3 speakers, and we have for physiotherapists who are members of member organizations, we have a bursary program, so speakers can apply for a bursary. However, there's only a maximum of 1 funding per focused symposium available, because we cannot spend the whole bursary on 1 or 2 focused symposia. So to make sure that the funds are equally distributed. So this is the question on funding, accommodation, travel, etc. This is the individual speaker's responsibility to organize that, to come to Tokyo and attend the event. If there's any individual questions further down the line, we are always to help, but it is the individual's responsibility. Luciano is asking, which element of the symposium should we place greater emphasis on? Abstract question mark. So Nathan, what do you think?
Yes, so basically your symposium is being judged by the CPC, the Congress Program Committee, so it will be reviewed. So basically you are convinced that your topic and your symposium is very important and it is of high quality, and you should let that reflect in your abstract, because it will be reviewed by independent reviewers. So I think it's very important to make clear why you think that this topic is very important to include in the World Physiotherapy program, so provide the background. And also, you need to understand that these are not the normal abstracts that you submit for the abstract platform presentation, for example, which are basically have a kind of background section, method section, and the results section and conclusion section. This is a kind of other submission. So basically, you will include the rationale. So why do you think this is an important topic? And explain the importance, what is already know about this topic, what the different speakers can add about this topic, and then what you also will present during the Congress. So it's a different abstract compared to the regular abstract submissions for a kind of research presentation. So I think that the rationality background is very important because you basically need to convince that your topic is very important and that you have also a high quality submission as well. So I think, yeah, and one good resource is of course the on the website of the Congress you also see the previous submissions, the previous sessions of the different World Physiotherapy Congresses, and you can also find the previous focus symposia there. So I definitely recommend you to have a look at those previous submissions because these were successful submissions. So no better way to learn how you can draft your submission on a way that is likely, or at least it's possible to be accepted, of course. So use that resource. I'm sure that you will have benefit from that.
Great, thank you, Nathan. And there's another question from Luciano. If you submit a symposium, can you submit a research? And I interpret this question as an individual research project. So certainly we wouldn't want to have one research project and one angle, but a more complex and broader view. But Nathan, perhaps you can comment on that.
Yeah, so I think also in the Dubai Congress, we also had some submissions that were not really adhering to the guidelines for a focus symposium, which is really a broader perspective, a very important global topic involving different perspectives on that topic and different speakers. So I think it's very important if you just want to report on a research project that you did, I think it's better to just submit an abstract for the oral presentations or the poster presentations. And the call for those submissions will go out later this year, I guess. So if you only have such a kind of specific topic like your research project, I think it's better to include that in another submission. But it can be part of a bigger picture in a focus symposium. So maybe you did a kind of very interesting systematic review on a kind of very contemporary topic, and you also have other people that you know who are also working on that same topic, and the other one has not a systematic review but did an RCT on that, and the other one did some qualitative research. So that could be a joined together to a nice focus symposium on that specific topic. But it's not really the normal abstract presentations, research platform presentations. You can better wait then for the other submission deadline that will follow later.
Great, thank you, Nathan. I think this was very helpful to understand the difference also between focus symposia and abstract submission. There's a question, do the presenters for symposium submission need to be from different countries? Nathan.
Yes, so sorry. So basically, during the whole conference and all sessions, diversity and international perspective are very important. So that is also applicable on the focus symposia. So we really want to have people presenting from different countries, but also from different perspectives, different backgrounds as well. For example, high, lower income countries. So I have different things that we can talk about. But with regard to the nationalities, so they need to be from different countries, but they do not need to be all from different countries. So it is allowed to have, for example, 2 people from the same country and then the other 2 people from other countries. But really think about that diversity and international perspective. So if you really think that two presenters from the same country is better for your symposium because they are really big experts on that topic, then it is allowed to include two people from the same country. But from my perspective, taking into account the perspective of diversity and the international perspective, please consider using those different perspectives also in including your speakers, and consider different countries from those speakers. And one thing is not really that it is not allowed, but I would be very careful with, if you do submit a symposium with two people from the same country, I would be very careful with including two people from the same institution, those kind of things. Because that's not, for me, that not really is reflecting diversity. So be aware of those kind of subtle things as well.
Yes, thank you, Nathan. So one aspect of a diverse panel is clearly the countries where the researchers or the contributors are based, but there's many other aspects you mentioned before: qualitative, quantitative research. You mentioned early, mid, late career contributors, male, female contributors, contributions from small, from big countries, from high income, from low income countries. Or I think these are all ways you can address diversity in your panel. And certainly you can't fit all of them, but in your submission you have the opportunity to explain on how you addressed this point. There's another question from David. Can you explain what the discussion session and clinical seminars are? I would like to take them perhaps one by one. Nathan, do you want to point out what is the difference between a focus symposium and a discussion session first?
Yes, so I explained the format of the focus symposia, of course. So those are linked presentations chaired by an expert in the field, and they are also working with the submission system. So the discussion sessions are sessions that are more organized by the Congress Program Committee and World Physiotherapy on very important topics that we would also like to address at the Congress. And these include also speakers from different countries and different perspectives as well. But there will be no submission for these sessions. So it's basically on invitation that people will be invited to join these discussion sessions. And they do not, for example, use PowerPoint presentations as is allowed, for example, in the Focus Symposium. So it's really a different format. So with regard, if you want to be involved in the Congress, you need to be invited for the discussion sessions. And this is your chance to submit something for the Focus Symposia, basically.
Yes, yes, thank you, Nathan. And what you said, it's that discussion sessions are, the topics are identified by the CPC. They are often controversial topics where there's a discussion required, and they are led and driven by the CPC, whilst the focus symposia are led and driven by you, by the submitters and the chairs of the session. Then there was the clinical seminars, and this is a new format. Perhaps Nathan, you can expand on what is the difference between a clinical seminar and a focus symposium.
Yes, and this is also new because I don't know what it was called last time. We also want to make a more distinguishment between these sessions, and that's the reason they now include the word clinical and the focus symposia. So the clinical sessions are more focused on a clinical question, can include different case studies or one case study in different perspectives. But as I believe, I'm correct, Birgit, these cannot be submitted by just anyone who would like to submit, because these can only be submitted by the specialty groups of World Physiotherapy. So if you are involved in a specialty group, and then you will receive an invitation to also submit these kind of clinical sessions, but you will receive a separate invitation for those sessions. So it's not possible to submit if you're not involved in those specialty groups. It's not possible to submit that session format. And the big difference is the clinical focus, of course. That does not mean that in a focus symposium you cannot include a case study or clinical aspects, because that's very important to have the clinical perspective as well. And it's not all about this question, but also with regard to different perspectives and diversity. I think it's very valuable to include different perspectives in your focus symposium submission. So the clinical perspective, the research perspective, the policy perspective, and also maybe other stakeholders' perspectives, like the patient perspectives. So it's very important to have a broad perspective in those focus symposia as well. And that can include, of course, clinical aspects as well, because we are physiotherapists, we're working clinically often. So I think it's important to include it as well in your focus symposium as well.
Thank you, Nathan. I think this drew up really nicely the differences between these two formats, with the focus symposium being more on a higher level. As you said, there can be contributions from a policy perspective, perhaps from a managerial perspective, from a patient, and then also from a clinical perspective. But the clinical seminars really are built around case studies, and hopefully will help people to change and amend their practice when they go back to their patients after the event. So they are more, I would say, more applicable and more practical. Practical is perhaps the word to use for participants. And what you said, Nathan, with the clinical seminars, yes, there will be a focused call going out to our specialty groups initially. And then watch this space. We will keep you posted and updated on any other opportunities to submit as we go along. And as long as you've signed up to the World Physiotherapy newsletter, you will be updated on anything, any opportunities to contribute in other formats. Okay, so there was one question Lucy has already answered in the chat. In case you haven't seen it, yes, you can submit an abstract submission and a focus symposium. They are not linked, they are two separate things. So you can be a focus symposium speaker and an abstract submitter. So please let your questions come in either through the chat or put up your hand, whatever you prefer. There's several pages of participants. I just have a look whether there's any hands up, so not at the moment. Then perhaps, Nathan, there's other questions that you could expand. So what makes a focus symposium so special that it would be included in the program? I think this is what many participants will be interested in.
And of course, it's a difficult question to answer. But I think, as I said before, the topic is very important. And I believe that the good focus symposium topic is broad, but not too broad. So when I remember, I submitted my first symposium for the Congress in Singapore, and it was rejected. And the 4 submissions afterwards were accepted. So, but the first one was really on a very specific topic, with a very specific regional topic in our body. And so I think we should have those more overarching themes and focus symposia. So those broader topics that are applicable on multiple disorders or conditions, or really include a very contemporary approach, discussion topics with you have identified in the profession. So I think the topic is very important to think about, because that is the most important thing, I guess. And then it's important to address the different perspectives on that specific topic. So no 3 or 4 presentations, more or less the same, but really, so make those presentations adding on to each other and really provide some benefits for your whole symposium as well. So different perspectives, and then of course you need to have some nice and good speakers as well, and that's maybe not so important. It's also important in the submission process, because also the quality of people and their background will be also evaluated, of course. But also some nice speakers are always nice to have on stage at the Congress itself, of course. So These speakers should be really experts in the fields, and of course they can be very seasoned speakers, and you can also include early career researchers. That's very also important. Address that diversity aspect as well, and also I think a kind of clinical perspective is also very valuable in the focus symposia. So addressing those different possibilities to address diversity are very important as well. I always do like when you not only present and also not only include work from others in your abstract, because it's very nice to be at the conference and to learn from the people who actually published about that work if you are a researcher. So also include people who can include work of their own, because I can tell you, I can give you a presentation about many topics, but I think you would prefer to hear me talking about the publications that I wrote. I think that's very important. So those kind of things are very important to have a kind of acceptance at the end. And of course, look at the selection criteria in the call. So it's important, and I have them here in front of me. So it's really about exploring, and that's then about the most recent ideas, the evidence, methods, and areas of controversially in the literature. So that's very important if you can address some of these kind of things. But also make also sure that it also inspires the audience, because people need to come to your focus symposium and they need to leave your focus symposium inspired. So make sure it is applicable for many of the participants, because it's a very niche area, it's not applicable on many physiotherapists, it's less likely to be accepted perhaps, although also in the program we want diversity. So also those smaller topics will definitely be included in the program as well. And then, so maybe then the last thing is really those different perspectives are very, very important. So you can have that by the speakers, different backgrounds, but also you can, if you have a topic, you can also include the perspectives globally. So you can, for example, include perspectives of low and middle and high income countries. So that's also very important. Really have that global perspective, because one thing I learned in the past years traveling all around the world is that the physiotherapy profession is also different in many, many countries. So I always like when that is also reflected in the focus symposium submission.
Great, thank you, Nathan. I think you brought up a very important point when you said when you talked about the niche area, and that ideally focus symposia should be appealing to a broad audience. And when there's a submission that is on a very niche area that only very, very few physiotherapists attending Congress will be relevant to them, then it is a topic, as you said, Nathan, that is worth talking about. But the question is a focus symposium the right format for this? So when it is very niche and very content to a very small field of practice or area in physiotherapy, then it might be better to submit an abstract on this to make sure it is being accepted. And there was a question from Priscilla: in case a symposium submission is rejected, does the rejection notice come with pointers why it was rejected? I don't know, Nathan, do you want to respond to this? Can then add to your response.
So no, if I understand the question correctly, so there will be no information provided, as far as I know, about why a symposium submission is rejected. So you will be notified of the outcome, but no reasons will be given why it is included or excluded from the program. And you should also keep in mind that there are many submitters of focus symposia, and they're but the only limited places of these key sessions at the conference. So don't be disappointed, I guess, when your submission is rejected. As I told you before, my first submission was also rejected, but that will motivate you to put in another submission next time as well. So the chance to getting accepted is not that very high, of course, because there are limited spaces of these key sessions at the Congress. But no information will be provided about why it is not accepted.
Yes, thank you, Nathan. Certainly no individual comments on the submission. So what we do usually when we review the proposals and look on things that come up over and over again, then we would include these in the feedback, but they are more general and not tailored to the individual submission. Yes, so what you said, Nathan, is also an important point about high quality submissions. And even if a submission is high quality, then sometimes it doesn't make it into the program, because sometimes there's submissions that are of a very relevant topic, but there are 2 or even 3 that are very similar, and then the CPC will need to make a decision which one to include in the program, which is not an easy decision, but they will certainly put a lot of effort into this to make sure that the best submission makes it into the program. But also other high quality submissions can sometimes not be included just due to space or overlap of topics.
No, I definitely agree on that. So there will definitely be submissions rejected that are of very high quality. So that's how it works, because there are not many spaces for these symposia, and we also, as I said before, would like to have different topics in the Congress program. So if there are some similar submissions, or for example, musculoskeletal health is always very important area, but many submissions, for example, on that area as well. So we cannot include 15 submissions on musculoskeletal health, although they are very high level submissions. So then, don't be disappointed, because many high quality submissions will be rejected as well.
Yes, and this is, I think, what you're referring to is also a mix of topics that the CPC will keep an eye on when reviewing, to make sure that there's also good diversity on topics and topic areas that the focus symposia cover. And there's a question: in case the submission is rejected, are we allowed to attend the Congress? What is the procedure? Does it need the invitation? So I'll quickly respond to that one. It is really the individual's decision to come and register for Congress. You can come as a participant without presenting. You can submit or be part of a submission of a focus symposia and then attend as a speaker, or submit an abstract. And then if your submission is successful, to attend as an abstract, either a platform or poster presenter. So it's really about your personal circumstances and your funding background, because sometimes we know from participants that they would only be funded or part funded by their employers if they contribute to the program. So if you're not successful in your focus symposium submission, you might consider submitting an abstract, and perhaps this will help you to get some funding to attend Congress. So at the moment, no further question in the chat. So let me just have a look. So we already talked about a few practicalities on how many presenters can be involved. I would like to perhaps go into a few more practicalities. What a question that sometimes comes up: should references be included in the submission, Nathan?
Yes, you can definitely include those references. In fact, I see now in the submission system that field is mandatory. So, but of course, I just also checked the previous submissions this morning, and there were accepted submissions with many references, with a few references, but also without any references. I believe that if you would like to submit a topic, then you should also provide some background information and the rationale because why you think that your topic is very important. So I think that you should at least include some references about why it is important, what is known already in literature, for example, in this about this topic. That does not mean that you should include a reference on every sentence in your proposal, because that's not really necessary, because maybe you want to talk about the different aspects of a kind of topic, and there's not much known in literature about that topic. So then it's not really necessary to include those references. But at least I think you should include some references about the background information. And so, yeah, it's not mandatory, although the field is mandatory. But I think, yeah, you need to include a few references definitely, because you want to give some scientific rigor to your submission as well, and not only your own opinion. So I think include those references if necessary. But as I said before, there were submissions in the past who did not include any references.
Yes, thank you, Nathan. And as you said, it doesn't need to be the longest list of references.
No, there's also a maximum of 10 references. So don't write it as an article that you put a reference or multiple references on every sentence, because then you will not have sufficient space, not for including them in the abstract itself, but also not for including them in the reference list, which can only contain 10 of the most important references.
Mm-hmm. Thank you, Nathan. And then a topic that also comes up every now and then is how to choose a topic for the focus symposia. So submitters will be able to select a primary topic and then also additional topics. This is important for us from the team once a focus symposium has been accepted, to make sure that we tag it with the right keywords and topic areas for people when they search for through the program, that they find the sessions that they are interested in. So Nathan, have you got any tips on choosing the topic, primary or any further topics for submissions?
Yeah, so basically I would say go through that list and read it very carefully. And sometimes it's very easy to make a choice, of course. And sometimes it might be difficult, but there is always a category other. So choose the one who's most applicable. For example, if you have a kind of musculoskeletal health issue, you can choose different ones. You have general musculoskeletal health, you have a lower limb, spine, upper limb. So you can choose those different aspects. But then maybe you have a kind of very contemporary new idea, and then you can also use the topic other. So just choose topics that are most applicable. You can select up to 3 topics, but it's not necessary. So the first one is important because you need to select at least one, and the other ones are really to also provide some guidance for people in the attendees later, to get it in the right track, because people are also searching on keywords, for example, later in the conference system, of course. So the more specific your keywords are, your topics are, the better it is, of course. But I also believe that with regards to the focus symposia submissions, if later on we see that it's not really the best topic that you have selected, that it can be changed. For the abstracts, it's not possible because there will be many abstracts, but for those 20-ish focus symposia, I guess it's always possible to choose the right one afterwards as well. But do a good job. It's not too difficult. There is a kind of list included in the submission system. Choose the one you think it works the best, and yeah, basically it's not too difficult, I guess, because there are some examples. You don't need to come up with the wording yourself. You can just pick the one that you think are most applicable.
Yes, thank you, Nathan. And also for those who have been involved in submissions before, read the list carefully, because the CPC has made some changes to the list. So there's some of the terms that have been expanded or slightly changed again, to make sure that really a broad area of physiotherapy practice, research and education is covered. So I can see we've got about 45 minutes now and approaching the end of this session. So if there's any last minute questions from you, this is now the opportunity to ask them. And I would like to ask one last question to Nathan before we're closing this session. So Nathan, What resources would you recommend? You already said the archive is something that people should look at in previous successful submissions. Are there any other resources you would want to point participants to?
Yeah, so I think the archive is the most important one, because you can see good examples of previous submissions. So really make use of that. Of course, the other most important resource are the guidelines. Yeah, you can't see them because they are blurred, but the guidelines are, of course, very important because you should fulfill and follow these guidelines, because otherwise it's not likely to be accepted, of course. And also on the World Physiotherapy website, there are also some other videos and those kind of stuff you can also use, of course. So I think that the guidelines and the archive are the most important resources. In addition to your own thoughts and the people around you, your colleagues, because if you really would like to submit a very interesting submission, it's very important to use the minds of the colleagues who you will be submitting with. So maybe if you have an idea and you have reached out to those other contributors, those other speakers, plan a session, an online session to discuss the topics and what people can add and the discussions that you will want to include in your submission, because it's really, yeah, you need to work together because these are very important sessions, and I think you can really benefit from that discussion with your colleagues who will also be involved in your submission as well. And maybe if you decide not to submit right now because you have a kind of reason or not the specific topic right now, I think you should definitely submit an abstract, because then you can just submit a research submission for a platform presentation, and then you can also join the conference, because I think it's very nice to be in Tokyo in 2025 and to join this great conference. And maybe then you can submit something for next time, because I have to admit that when I have submitted Focus Symposia, I already knew the topic that I want to submit something on the previous conference, because then you see the program, you see what's missing, for example, you get new ideas from the sessions that you have attended, and then at that time you can also get new ideas for new Focus Symposia in 2 years. So if you don't submit now, please join the conference, be inspired, and then submit something for the 27 Congress.
Yes, thank you, Nathan. And then also what you said, reaching out to colleagues in your topic field, so and network to be ready for the next Congress, then for a focused symposium submission. There is another question from Rebecca. If a potential presenter is from a low-income country who does not have any published work, can they present their perspective from a clinical experience?
There's no need to be a published presenter, author, for example. Of course, I think it will have an added value if you have a kind of track record on a kind of topic, of course, but it's not necessary. And especially it's not necessary that all presenters have a track record in publications. So as I said before, different perspectives are very important. So for example, you could include the chair can be a recognized expert, a published author, for example, a professor. You can include maybe an early career researcher, a PhD student. You can include a clinical perspective by a clinician who is not a published author but has a lot of expertise in the topic and works with those patient groups that your submission is about. And for example, you can include a person from another country, maybe a low-income country, to provide some new insights on how that topic is addressed in low-income countries. And that you have different perspectives, and then also include the clinical perspective, so people do not need to be published authors at all. Of course, I think it's helpful that some of those have a kind of track record of as well, but the clinical perspective is even important, I guess. So that's definitely possible.
Great, thank you. I think very important question, and it's great. I'm pleased that it came up. So I think we are concluding this session. Nathan, any last words, any last recommendations for all the participants here who will submit focus symposia?
No, I think I hope that you learned something today, got some new insights and some inspiration just to go ahead and submit and make us as the CPC work hard. So submit all your focus symposia. We love reviewing them, and of course, start. I think the time to start is now, because of course you have 1.5 months left to submit. But I think it's a lot of work to make a good proposal. It needs some talking and discussion with your colleagues. So really start now, and you are here, so you had a kind of idea. So start after this meeting, start immediately with reaching out to people, putting some things on paper, and then hopefully we are all meeting together in Tokyo in 2025.
Great. Thank you, Nathan, for being here and sharing your experience from previous submissions and also as a CPC member. And for all of you, I wish you all the best for your submission. And remember, the deadline for submission is 25th of April. And we look forward to receiving your submissions and seeing you in Tokyo. Thank you. Bye-bye.
Bye-bye.